Good afternoon. Good afternoon. Welcome, everyone. This is Dr. Velma Scanterbury, and I am coming to you live from DPC Educational Center, being here on a Facebook Live. I hope many of you get a chance to log on and to ask some questions. So welcome again. I'm here in Delaware. I'm actually working from home today, so you may see a different background. And so I am here representing Dialysis Patient Citizens Educational Center, and we are having these Facebook Lives once a month along with Instagram Live, and you will see many others on the web page, as well as if you haven't joined DPC yet on the Facebook, please go to Facebook and sign up. There's also Instagram information. There's also Instagram link as well that you can also get more and more information on how to do better on dialysis, how to advocate for yourself, how to find a living donor. If you have questions about being on dialysis, do you know the difference between peritoneal dialysis and hemodialysis? And we have some more educational sessions coming up later on this month. So I invite you to join and participate in these live events. There are occasions to learn more, gain more knowledge and understanding, but also to ask questions that you may have that you may not be able to find answers on. So, some people use Google a lot, Google to find all the answers to their questions, but sometimes that information is not always 100% correct. So if you find information and you want to verify that, you really should talk to your healthcare provider. So that is important. Again, I said I'm Dr. Scanterbury. I'm here on Facebook Live. Ask the doctor if you have any questions about being on dialysis and getting a transplant. How long have you been on the list? Have you been evaluated? Do you have a friend that needs to be evaluated? How is that evaluation process going? Is it taking a long time? Why do you need all these tests, as patients usually ask? Why do I need to go through all of these tests? And what does it mean being on the list? And why does it take so long to find a living donor and a deceased donor? And deceased donors, there's so many people waiting for transplantation. We don't have enough deceased donors to go around. While we advocate that people talk to their family and friends about really being a deceased donor after your death, not every person who signs up to be a deceased donor may end up being able to donate. They may not be able to donate organs, but they may be able to donate tissue. And remember that tissue is also part of donation. So it's organ and tissue donation. And the more we get people to understand that donation is needed, the more consents we will be able to obtain, because it's a gift. It's really a gift that allows someone else to have a better quality of life, allow someone else to be saved by that transplant, especially if it's something like a heart transplant, liver transplant. Those things are important because those save lives. Tissue is also important when it comes. People don't realize if you had a cornea transplant, that's a tissue transplant. If you got burned and you need a skin placed on your burn, that's also partly tissue. People use ligaments, long bones, all those things can be used. A lot of heart valves come from hearts that are donated and not unable to be used, but they use those valves to build other valves for people who need valve replacement because of the underlying heart disease. But as far as tissues, as far as solid organs, you can donate your heart after your death, but you can also be a living donor for your liver. You can donate part of your liver to someone who is in need. Usually a lot of parents do that, or relatives do that for their loved ones. You can give part of your lung to someone else and still survive with your remaining lung. So oftentimes for children, especially who may have cystic fibrosis and may need to get all lungs replaced, they can have two different people donate to get them back to wellness. So it's important, and as a kidney recipient, you certainly, a kidney person on dialysis, you can certainly reach out to someone within your friends, within your family, within your co-workers. The more you talk about your disease, the more you can educate other people about understanding the risk of kidney disease, the risk of diabetes and hypertension as the two leading causes of kidney failure. Many people don't realize that, but when you talk about your own process and what you've gone through, it can educate others, and it can give them a better understanding of what they need to be more educated about. So there's a question there. I'm very anxious when I go to dialysis. How can I deal with this feeling of fear? And certainly dialysis will cause anxiety, and many patients are anxious about several things. So the question is, what are you anxious about? Is it being stuck by the needles? Is it that your blood pressure will go down? How well, would you do poorly on dialysis? What are the things you need to get over? You can really talk through that with your healthcare providers. Sometimes they may need to help you get through that feeling. Oftentimes there may be a social worker, someone there who you can discuss your fears with, and be reassured. And it depends on how old you are. How often is your dialysis? Do you have trouble with your dialysis? And how can you eliminate those things that are causing you to have this feeling of fear? So, granted, there are complications on dialysis, but not everyone faces those complications. And the more balanced you are with your fluid volume, the less challenging your dialysis will be. So if you're going into dialysis and you have too much fluid on board, then the work of the dialysis may be a little bit more profound, and those patients who require more fluid being removed may have issues with the blood pressure falling towards the end of dialysis. So you want to look at what you can do to eliminate problems on dialysis. So talk to your healthcare providers, talk through your feelings, and maybe talk to someone about what can be done to get you past that fear and help you deal with that fear that you may be having. And so, yes, some people have fear of needles and how much it hurts. Oftentimes they can, do something with giving you some medication at the site so that you're not having that painful experience every time you place those needles there. If you're on hemodialysis, which I'm assuming you're talking about, so don't be afraid to talk about your fears. Everyone has a stigma, about talking about things that bother us, but it's quite normal. And so there may be a way for your healthcare providers to help you through that fear and help you overcome that fear. Once you talk about it, you may see that it may not be as bad as you think, but not to undermine your feeling, but really get into the source of why you're fearful and what can be done to help you feel better and be able to deal with the experience of dialysis, especially if it's something you're just starting out to do, you're not used to it. For those people who've been on dialysis a while, it may become routine, but you still have that anxiety, and that's sometimes quite normal. I used to operate quite often, but with every single transplant, when I go into the room, I still have that anxiety. I have that. I'm having that. Want to make sure I do everything right and make sure everything goes well. So I still have that. I don't go in feeling like I can get over this, but I go in knowing that I'm in the hands of a higher being, and I really want that help to be able to get through it. So with every case I do, I still have a little anxiety, and that's normal. That's normal for me. And so the question is, what's your anxiety due to, and how can you overcome that? So thank you so much for that question. Again, I'm Dr. Scanterbury. Here as Ask the Doctor on this Facebook Live for Dialysis Patient Citizens Educational Center. I work with Nancy Scott, Educational Manager, and so I'm here to answer your questions. Thank you for joining, Yolanda, Cherie, and Mary. I appreciate you being here. And please post your questions if you have any. We know it's summertime. Today it's kind of gloomy, but there was raining earlier, but we're grateful for that rain, because every day that we're alive and every day we're able to function is a blessing. So we're thankful for every day that we can be able to do something and make a difference. So another question, a patient shared that after testing, they were not eligible for transplant because of too much calcium in their body. Can anything be done? Generally, that's becomes an issue in terms of, you know, being on dialysis leads to calcium phosphorus imbalances, and making sure you keep those regulated, because they're usually controlled by the kidney, and so it's important to keep it under control, maintain good phosphorus levels, keeping your calcium from accumulating on your calcium phosphorus deposition. So that becomes important. Unfortunately, the downside of that is that the longer you're on dialysis, or the more of these things are not controlled, the more calcium will build up in your blood vessels. And so you develop what's called atherosclerosis. And so for many patients, it's really about how bad is this buildup of calcium in the blood vessels, and will those blood vessels be able to be amenable to making a connection to the new kidney. And unfortunately, calcium becomes like, you know, chalk, and it becomes very hard, and that makes it impossible to chisel through those hard lining of the blood vessels in order to make those connections. And what happens is, when that calcium deposits in your blood vessels, it makes your lumen go from being wide open to very, very small. And so you have those depositions, and you're more at risk for very subsequent events. So the problem is that once those calcium, and you're at risk for worsening heart disease, peripheral vascular disease in your legs, more at risk for those blood vessels not being able to deliver the blood that's needed to benefit from the transplant. And that the consequence of having those lead pipes will not really be reversed by placing a kidney transplant. So unfortunately, that's usually a big issue, is with too much calcium buildup is damaging of the blood vessels, and the inability to be able to actually make those connections, because your blood vessels are too hard. And many of our patients are unable to have the transplant placed because there's just too much calcium. Oftentimes, for some patients, it may be about getting a vascular consult to see if they can put an artificial segment of a new vessel in that area that needs to be used for the kidney transplant connection. And that's called a bypass graft. That may be possible, but oftentimes to do that, you need to have two good areas to connect that bypass graft to. So you have to find a spot above in your bad blood vessels, and a spot below. So unfortunately, those are things that they usually will have a consult and decide whether or not such a thing is amenable. The other issue is to maybe also see if there's a more aggressive transplant center that may be willing to take on this task. And so you can always get reevaluated at another transplant center and see what their thoughts are. So thank you very much for that question. Thank you, Elizabeth, for joining. I appreciate you being here. Your question, and what are some good strategies to handle the fatigue experienced after dialysis? And, you know, when you have to imagine that when you're on dialysis, you go in after you have, and this, I'm assuming this is from hemodialysis, because you have accumulated all these waste products over time, and so whether it's 2 days or 3 days, now you're on dialysis, and you've now taken off that fluid, that extra fluid and those waste products. So your body accumulated over 36 hours or 48 hours or 72 hours, and you go to dialysis, and now you're expected to take that, cleanse your body and take off that extra stuff in 4 hours. So it's almost like squeezing. You have a sponge, and the sponge is comfortable with its fluid, and now you have squeezed that sponge and taken off all that extra fluid. So what's going to happen? You're going to feel fatigue. So the less aggressive you are with your volume gains and minimizing your gains, the less fatigue you may feel, because there's less shift in your body's volume and the things that are being removed. So if you gain 10 kilos, taking out that 10 kilos is really squeezing your blood vessels dry, and you're going to walk away feeling really, really drained. But if you only have to remove 2 kilos, there's not much in terms of the difference in what occurs. So strategies are to minimize your volumes gains during the time before dialysis. I know it's hot outside. Come up with strategies to really stay cool, freeze those grapes, freeze those little fruits, and that way you can use those to cool down and minimize your volume intake from that standpoint. So talk to your healthcare providers to see how you can really decrease that fatigue after dialysis, so that you can at least do something after you get home, or not have to feel like you need to pass out. So thank you so much. I really enjoy these sessions. Thank you for all your questions. And there was a DPC Citizens. For more information, certainly you want to be able to go to DPC Citizens website, learn how to elevate your voice through advocacy. You know, there's a grassroots manager, Yolanda Brisbane. Thank you for being on. You can give her a call, and she will tell you many different ways of how you can get involved in terms of advocacy for yourself, as well as those who you may know on dialysis, who may need to, who may not be as aggressive in raising awareness and being able to do things. So thank you so much. How can we protect ourselves from infections in dialysis centers? I think one of the things you want to make sure is that, while I'm sure they disinfect the sites before and after you're there. You want to make sure that as far as personal protections, you can always wear a mask if you feel like there may be others around you who may be sick or coughing. Masks are still optional. I see many people still wearing them. They offer some protection. And now that the air quality is not great outside, if you're living in one of those areas, there is some benefit from wearing that mask when you're outside. It can keep you from getting those allergies, and also from irritating your lungs. So that's often something you can do. But in dialysis, you can make sure you keep yourself clean, that your sites where your needles are being placed are clean and healthy. Certainly the nurses make sure of that before they put their insert the needles into your arm. But certainly as far as infections around others, the best thing you can do is protect yourself by wearing a mask, making sure you use your hand sanitizer. When you go to the bathrooms, if they're common bathrooms, you want to make sure that you're careful if you're touching doorknobs or going in and out, that you sanitize out if you have to still touch the doorknob. We were very careful during COVID, but now we're out of the COVID pandemic and we're more in the endemic stage. We tend to forget that there are certain things that we can still continue to do to protect ourselves. And that also reminds me to remind you that we're likely to have a new vaccine in the fall, a new focus on a different variant. It's not going to be the bivalent vaccine. It'll probably roll out as a monovalent against a new variant. And so for those of you, it will be likely mid to late September, who are immunocompromised, to make sure you talk to your doctor or your healthcare providers to really get vaccinated when it's time to protect yourself from infections. Get your flu vaccine in the fall, but also as you continue on dialysis, continue to be vigilant about hand sanitizer, hand washing. If you're concerned about others having infections around you, wear a mask to protect yourself as well. So thank you so much. This is Dr. Scanterbury again. I am here at Dialysis Patient Citizens Educational Center, talking to you today about anything you want to talk to me about. Whether you have questions about dialysis, transplant, getting on the list. One of the things I want to tell patients is that it's also important, if you're a dialysis patient, if you're post-transplant, make sure that you continue to get exercise. And so it's certainly not every day, not on your uh, not consecutively, but on your non-dialysis days. If you're at home, whether it's chair exercises, if you're unable to walk around effectively, you may be able to hold on to a chair and walk in place. If you think your heart really needs to be challenged, and getting your blood vessels moving, pumping more. So if you're not at risk for severe heart disease and have trouble breathing, the goal is how can you do simple exercises while you're sitting in a chair. Perhaps you can find some things to just use and raise your hands and exercise your arms. I have, whether it's a can of beans or fruit, it's a pound. You can use these for exercises to exercise your arm. You can use different things while you're sitting to be able to give yourself that little exercise. If you have access to a exercise band, you can put around your legs and you can strengthen, sit there in a chair and do those exercises. So if you think about the fact that muscles will atrophy when you don't use them. So if you are paraplegic or hemiplegic and you don't actively use those muscles, they will slowly get smaller and smaller. And lack of disuse, they're unable to really do what they need to do. So your heart is considered is a muscle. So you want to be able to strengthen your heart, even though what you're doing on dialysis is really taking fluid off, and sometimes with long-term dialysis patients, that fluid will stretch your heart. But you want to be able to maintain the tone of your heart, and a lot of that comes through both aerobic and anaerobic exercises. So we want you to continue to find ways to take walks. If it's too hot outside, find a mall, find something indoor, go to some indoor big store and walk around. Try not to shop too much because it's the sustained walking at a certain pace that's really going to elevate the strength of your heart and build your heart muscles. Whether you like gardening, whether you like doing housework, even pushing the vacuum around the house is work. And anything that makes you pant and cause you to get to breathe deeper is also challenging your heart. So think of ways that you can get that exercise in, but don't think of it as exercise. Think of something that you're doing that could be fun, such as dancing. Put on some good music and dance around your house. Listen as you're washing dishes, cleaning things, doing the laundry. Those things will allow you to really build better strength and build better stamina. And even for patients who come to us to be evaluated for transplant, we want to make sure that you have stamina and endurance. We want to know that after the transplant, you will have the strength, despite the pain, despite the uncomfortableness, to get up and walk around, that you'll be able to not have to go to a rehab center or nursing home because you're so weak and unable to get out. So if you're dialyzed 3 days a week, you want to be able to push yourself to see what you can do to get up and get going on those off dialysis days. So this is something that's important to maintain good heart health. And even for us who are not transplant patients and not dialysis patients, the goal is for everyone to try to get at least 3 days a week, 30 minutes a day, so you can find ways to incorporate that into your daily schedule. One person says 22 years and counting on the chair. I have my life and work figured out around my dialysis. Raised 3 girls, now proud. So now the proud grandfather of 13. Congratulations. Thank you so much for sharing that. Awesome. I hope you continue to do well and continue to inspire other people. One person says, I need help. Please, Dawn, what can I help you with? This is Dr. Scanterbury. I hope we can help you. If you just let me know how we can be of help to you. Again, if you're on dialysis, ask your questions. If you're a transplant patient, I hope you're doing well. I hope you're compliant with your medications. I know sometimes it's the idea that people are constantly telling you what to do, take this, take that, come back. But remember, even after you have a transplant, rejection is silent. So monitoring becomes important. The last thing to really change is your creatinine. So we want to make sure that things are occurring before we see changes in your creatinine. We want to make sure that you continue to do well, and so monitoring of your transplant, monitoring of your immunosuppression. Unless your kidney is from a identical twin, your body will eventually wear out that kidney. Some people will get 15 years, 20 years. Some people may get 3 years or 5 years. But we want to be able to see what's happening with that transplant and try to delay that chronic rejection that ultimately may come. When it may not come when we want it, when we think it will be, and some people will continue to hang on. So you want to be able to be monitored. So whether you're getting labs every month or every other month, think of that as your lifeline to that kidney, and making sure that that your labs are being monitored, that you are not getting severely anemic, that your heart isn't getting worse, that you're not developing complications. And most importantly, follow-up is for all of us is cancer surveillance. Now that the summer is here, make sure you use that sunscreen and sunblock, because skin cancers are one of the most common cancers. It gets ignored because we think it's just a little mold. So get your doctor to check anything that you feel is doesn't look right, doesn't feel right, is changing size or texture, is itching. Those are the things you want to stay vigilant about. Wear a hat, cover your ears, make sure you put sunscreen on your nose, your ears, and if you don't have any hair, make sure you cover your head. So those things are important. So as you're outside, make sure you don't get with the problem with the heat, and you're unable to drink a lot. Make sure that you're not in a place where you may get heat exhaustion. So stay protected, stay cool, and continue to do those things that will enhance your health, so that you can do better on dialysis, so that you can continue to do well with your transplant. And even if you're a living donor and you have donated, remember that you still need to have that one kidney checked annually, and just to make sure that you're continuing to do well with that one kidney. So thank you so much, guys, for watching. I'm Dr. Velma Scanterbury. I am the medical consultant for DPC Educational Center, and we bring you this Facebook Live interaction once a month. We also have an Instagram Live every alternating with this, also once a month on the first and third Wednesdays of the month. So if you're not here for the Facebook Live, you can also join on the Instagram Live. So if you have any questions, we have about 2 more minutes. Dawn, I will inbox you at the end of my session and see if there's anything I can do to help you. Thank you, Soju, for coming on. If you have any questions, let me know. If you have questions and as we come to the end and they're not answered, you can sure to put them on the website, post them on the Dialysis Patient Citizens Center, and they will get those questions to me. So again, you guys have a great afternoon. Continue to enjoy the rest of the week. If it's sunny your way, enjoy. If it's raining, think of it as a blessing for all the plants and all those things outside who need that extra water. And it gives you a chance to maybe relax, regroup, and read a book at home. So enjoy, everyone. Have a great day, and we'll see you next time. This is Dr. Scanterbury signing off for Dialysis Patient Citizens Educational Center Facebook Live interaction, and I'll see you next time. God bless. Have a great day.